Dr. Andrew Huberman is a neuroscientist and professor of neurobiology at the Stanford University School of Medicine. He is known for his research on brain function, sensory systems, and brain plasticity. He is also the host of the popular Huberman Lab podcast, where he shares his knowledge on various topics related to neuroscience, biology, and health. In this video we are going in detail on how to lose weight according to Dr. Andrew Huberman. Caloric deficit. Losing fat requires a caloric deficit, which means burning more calories than you consume. You can create a caloric deficit by reducing your calorie intake, increasing your physical activity, or a combination of both. Yes, that's correct. A caloric deficit is the most important factor in losing fat. To create a caloric deficit, you can either consume fewer calories than you burn through your daily activities and exercise, or increase the number of calories you burn through physical activity. A combination of both approaches is often the most effective for sustainable weight loss. Protein intake. Consuming adequate amounts of protein is important for losing fat while preserving muscle mass. Aim for a protein intake of at least 1 gram per pound of body weight. It is true that consuming adequate amounts of protein is important for preserving muscle mass while losing fat. However, the recommended protein intake can vary depending on factors such as age, gender, weight, and activity level. According to the American Dietetic Association, the recommended dietary allowance for protein is 0.8 grams per kilogram of body weight per day for the general population, which is equivalent to about 0.36 grams per pound of body weight. However, for individuals who are engaging in strength training or other forms of exercise, higher protein intakes may be needed. It's best to consult with a registered dietitian or healthcare provider to determine the appropriate protein intake for your individual needs. Time-restricted eating. Time-restricted eating involves limiting your eating window to a specific period of time each day. This can help regulate hunger and improve metabolic health. Try starting with a 12-hour eating window and gradually decreasing it to 8 hours or less. To add to that, time-restricted eating can also help in reducing overall calorie intake and promoting fat loss. By limiting the time during which you can eat, you may naturally consume fewer calories. Additionally, it may help regulate hormones such as insulin and improve the body's ability to burn fat for energy. Intermittent fasting. Intermittent fasting involves alternating periods of eating with periods of fasting. This can help create a caloric deficit and improve metabolic health. Popular methods include the 16:8 method, fasting for 16 hours and eating during an 8-hour window, and the 5:2 method, eating normally for 5 days and restricting calorie intake for 2 days. Yes, that's correct. Intermittent fasting is a popular approach to weight loss that involves cycling between periods of eating and fasting. The 16:8 method and 5:2 method are just a few examples of how intermittent fasting can be done. It's important to note that while intermittent fasting can be effective for some people, it may not be suitable for everyone, especially those with certain medical conditions. It's always a good idea to speak with a healthcare professional before starting any new diet or exercise regimen. High-intensity interval training. HIIT involves short bursts of high-intensity exercise followed by periods of rest. It can be an effective way to burn fat and improve cardiovascular fitness in a short amount of time. Yes, that's correct. HIIT has been shown to be more effective than steady-state cardio for burning fat and improving cardiovascular fitness. The short bursts of intense exercise increase the body's metabolic rate and continue to burn calories even after the workout is complete. HIIT can be done with a variety of exercises, such as sprints, cycling, or bodyweight movements, and can be adapted to different fitness levels. It's important to properly warm up before starting a HIIT workout and to gradually increase the intensity over time. Sleep. Getting adequate sleep is important for regulating hunger hormones and improving metabolic health. Aim for 7 to 9 hours of sleep per night. Yes, that's correct. Getting enough sleep is essential for overall health, including weight management. Lack of sleep can disrupt hormone levels, leading to increased hunger and cravings, and decreased metabolism. Adequate sleep can help regulate these hormones and promote fat loss. Mindset. Cultivating a positive mindset and focusing on progress rather than perfection can help you stay motivated and on track with your fat loss goals. Celebrate small victories along the way and don't be too hard on yourself if you have setbacks. Yes, mindset plays an important role in achieving any goal, including fat loss. It's important to approach your goals with a growth mindset, which means recognizing that challenges and setbacks are opportunities for learning and growth. Focus on progress rather than perfection, and celebrate small victories along the way. It's also important to be kind to yourself and avoid negative self-talk. Instead, use positive affirmations and visualization techniques to help you stay motivated and focused on your goals.